my name is Kim Walters. I'm the clinic manager for Yunus Doğan here in Istanbul, Turkey. Today we're going to talk about complications and risks that may come along with some of the surgeries that we do here in our clinic. We're talking about tummy tucks, lipo, any type of lifting surgery, whether it be a breast lift or arm lift or thigh lift, breast implants, so any type of surgery that we may do here. All surgeries always come with risks and complications, and today we want to talk about those. So here today we have our 3 clinic doctors. We have Dr. Yunus, Dr. Jamil, and Dr. Ahmet, and they will go over the complications with you today. Today we're going to start with Dr. Yunus.
Hi, I want to begin with one of the most dangerous complications, which name is blood clot and embolism, usually pulmonary embolism, sometimes brain embolism might happen after surgery. This is usually related with general anesthesia and immobilization during surgery, and also patients from other countries who has flight over than 8 hours, they are especially under risk because even this during this flight this blood clot might occur inside their leg veins, so they are risky. For this reason, for prevention especially, we want to wait at least 2 days before their surgeries if they have over than 8 hours flight, and as I said, this is usually related with general anesthesia, and when we do, for example, a tummy tuck, also we do muscle plication, and this plication increase the intra-abdominal pressure, and it might affect venous flow back to heart, and it will cause TAZ, and it will cause blood clotting as well. So we usually use stockings during surgery, pneumatic compression devices, and after surgery in our routine protocol we use blood thinner injections for 7 days at least, but this is related with patient's general health situation, and we change our protocol patient to patient. This is a dangerous complication, as I said before, so we have to be careful. I told you the preventions that we perform always, and what happens if it occurs. This is dangerous because this might cause pulmonary embolism. This clot might move upward to lungs and might cause stase and blood circulation problem and breathing problem on lungs, and might be fatal as well. So for this reason it's dangerous, and we have to be careful, and we have to perform all these surgeries in a hospital, not anywhere else, and third step hospital we prefer, because we might need intensive care unit and cardiologist and chest specialist and CT scan, all these properties we need. For this reason we are performing our surgeries in a third step hospital. This is what I want to say about blood clots. Now the turn is Dr. Jamil's, I think.
Yeah. Dr. Jamil, can you tell us something about SEROMA, another one?
Hi everyone. Surgery causes damage to blood and lymphatic vessels on surgical site, and SEROMA is built up of fluid on body area where tissue has been removed. Repeatedly fine needle aspiration is used to this area and sufficient fluid and garment taping overlaying skin and most importantly serial
Aspirations.
aspirations and most importantly getting serial lymphatic massage is preventing this condition.
Excellent. Yes, massage, so important. And how about, Dr. Ahmed, can you tell us a little bit about wound healing complications or risks?
Wound healing process is a delicate and complex situation, and it's immediately after surgery our bodies immediately starts wound healing. It is starting with blood clotting, and after that inflammation phase occurs. Inflammation must not be confused with infection. In inflammation phase, it's a normal healing process. There might be some swelling and some redness and mild pains, and this is normal. And after that, our body starts to producing scar tissue, healing tissue. That phase, we call it proliferation phase. After proliferation, our bodies starts to strengthen and remodeling that new formation of scars. And wound healing problems in modern surgery is still a problem, and we see it common. Most common, we see inflammation, wound healing problem in where tense areas occurs, like T area of the breast or the most tense area of abdominoplasty surgery. And what we do in wound healing problems is in the beginning, we start recognizing main problems. If it's due to blood circulation problems, we use heparin creams, for example. Or if it's due to infection, we are using antibiotics to prevent it. But mostly it is due to damage to skin, and we mostly treat it with antibiotic ointments and dress changing. In the most of the population of patients, dress changing and antibiotics will be enough for wound healing problems. But sometimes damage is too high and our skins go to necrosis, skin death we mean. If this happens, and it might happen, but it is rare condition, firstly we have to clean that wound and clean that dead tissue out of our body. After that we may need to resuture it and doing some dress changing also.
All right. Thank you so much.
You're welcome.
All right. And how about fat embolism?
The turn is mine again, and again one of the most dangerous complications, which might be fatal. Fat embolism, usually related with fat injection to butt area, BBL surgery, during BBL surgery. And when we put this fat inside butt muscle, risk is high because of venous vessels over there, because there are big vessels under or inside butt muscle. For this reason, we don't perform fat injection inside butt muscle, but everyone can say that we don't put it inside muscle, we put it just over muscle plane. So we have to be sure about this, because safety is our priority, as you know. For this reason, we are using ultrasound guidance during surgery for 3 years, and over than 700 BBL surgeries we performed under ultrasound guidance, and thanks God and science, as I said before our videos, we don't have any fat embolism complication so far. And there is one more thing. It's sometimes people and doctors also might misunderstand it. Fat embolism syndrome. Fat embolism is a mechanic issue which might be fatal, like blood clot, and when we put this fat inside butt muscle and it goes inside veins and goes up to lungs and might do restriction for breathing, and this is a fatal issue first 6 hours from injection time. But fat embolism syndrome is a different issue, and it is related with fatty oil inside this injected fat. And this is an inflammatory response which might cause breathing problems, but this is not a big issue and not dangerous issue like fat embolism, and this might be treated with steroids or anti-inflammatory medications. These two different issue name is similar, but table and the situation is totally different. Okay, that's it.
Excellent, thank you. And Dr. Jamil, will you tell us about hematomas?
Absolutely. Hematoma is collection of blood in surgical area. It's a rare complication in body contouring, but additional intervention is necessary. Depending on type of procedure, hematoma incidence and presentation can be very greatly. We assess our patient's family and personal medical history before surgery, and then medical surgery is important. Important is preventing this condition. However, there are something that our patients should pay attention to. Patients should avoid any blood thinning medication, including aspirin and other anti-inflammatory drugs. These drugs, patients should avoid these drugs before and after surgery. Risk may increase green tea usage, and if patients got her period, maybe increase.
Maybe we can tell about herbals, not just green tea or green coffee. Herbals might increase the risk of bleeding during surgery. Blood thinners, just aspirin, as you mentioned, we don't want to use it 5 to 7 days before surgery, and there are some certain surgeries that we have high risk, like tummy tuck or breast reduction surgeries, but you know, and we are performing that we are doing quilting stitches after abdominoplasty surgery because we don't want any dead space over there, and this also prevent seroma formation as well, and especially men population tends to have this hematoma. As you know, our patients usually men for hematoma, and 4% post-bariatric, yes. 4% for women, 15% for men. These hematome rates are like this, maybe.
Wow. All right. All right. Thank you. And Dr. Ahmet, how about infection?
Infection is an important complication in surgery. Surgical site infections may prolong our hospital stays and may risk the health of our patients. The most crucial part in surgical site infection is prevention. We do every measurements to prevent surgical site infection. For example, we are using sterile surgical instruments, and before surgery we clean our patients with like povidone iodine antiseptic solutions, and also surgeons hand cleans is really important, and by the surgery, before the surgery, we use some antibiotics to prevent infection. As I mentioned, most crucial part is prevention, but sometimes infections may occur. Some harmful microorganisms like bacteria may go inside of our wound, our surgical site. That time we call it surgical site infection. If it happens, we have to be vigilant and careful about the signs of the infections, which are the fever, systemic fever, bad smelling from the wound site, and purulent discharge from the wound. So if it happens, we have to be careful and we have to start antibiotics and treatment quickly. Mostly with dress changing and using antibiotics, these infections treated. Sometimes additional surgical procedures may be necessary. The most important part is prevention for surgical site infections, and we do everything what we can do about it.
Maybe you want to talk about also necrotism facciate, which is rare.
Yes, it is
so important.
One of the rarest complications about infection is necrotism fasciitis. It's an important, maybe fatal complications. It's the main cause of it is some kind of bacteria like Streptococcus or Staphylococcus aureus sometimes. If it happens, surgical debridements may be necessary, and repeatedly we have to do it, surgical debridements, until the infection signs has gone, and after that we are reconstructed it sometimes with skin flaps or skin grafts. It's an important and maybe fatal surgical complication. The most important part is to recognize it if happens. What we do for it is we check out our patients daily, and even after they go to their country, we are controlling them with pictures and with online consultations. And if any signs of the infection starts, we immediately start treating it.
Okay, especially patients from other countries, when they return back to their home after maybe 5-7 days later, they must be careful about disinfection rules.
Yes.
As we do during or before or after surgery, they have to do it, because necrotism fasciate usually for us usually a late complication after 4 days. Surgical site infections are usually 4 days after, but this might recognize it by us late. And as you know, being late is too dangerous for this infection. So even after arriving home, you have to keep contact with us, and you have to obey the rules of disinfection, and you have to understand the signs of infection. That's it.
All right. Yeah. So I think that we've covered all of the risks and complications. I know that when I join you guys in our consultations, I hear these same risks and complications being spoken every day to our patients. I just thought this was another good way to let them hear them again. So I want to say thank you guys, and I hope this is helpful for all of our patients, past and present and future. So
Maybe we have to do a complication session again because of the complications related with appearance. Yes, we are plastic surgeons and appearance is important, and the most common complications are usually about appearance,
Yeah.
asymmetries,
Yeah.
irregularities.
Yep. Those are definitely different ones. Today I wanted to go over the risks, the ones that are serious, that have to do with our health. And we will definitely do another sit-down talk about revisions or the things that we see after that we might want to talk to our doctor about that are not fatal or things like that. So that will be for another time, but today we wanted to go over these important risks and complications that we fear so much.
So see you in minor complication session.
Yes, minor complication session
Yes.
next time. So thank you guys very much.
You're welcome.
And
You're welcome.
I'll see you again soon.